Hello, hello, hello. This is Danny Suarez with Unleashed Consulting and the Best Boss Bootcamp podcast. Welcome, listener. And for those of you that are viewing this, we haven't, at this time that we're recording, we haven't done anything with our video, but just so you all know, I'm wearing a pretty fabulous shirt. My guest is amazing, so I hope you'll check us out on YouTube after you listen to us. I am so excited. I know I say this every single time, but I'm serious. I am so excited about my guest this morning. My guest is Donna McNichol. Donna and I have been, I know I say this every time, but like 100% more colleagues and friends for how many years, Donna? Like how
Well,
long have we?
I look younger than I am, so
Yes.
I don't know, like
Yeah,
probably like I don't know, 25 years.
I think you're right. Yeah, I
Yeah.
think you're right. That is crazy. So Donna and I first originally met through some training that I was doing. So we were both working for the same organization, Planned Parenthood, and through some training, I don't even, was it Management Mastery Series, Donna?
I think that was the first one. Yes.
Okay. All right.
Yes.
So through a comprehensive training series, much like the Best Boss Boot Camp, called the Management Mastery Series. Anyway, that's how we met, and we've been friends and colleagues. Neither one of us working formally for Planned Parenthood any longer. But let me introduce you, Donna, formally, and then I want to talk to you. I'm so excited to talk to you about fire hose management because it's gold. Okay, so Donna has worked in healthcare services for most of her professional life. She has direct healthcare experience. Hold on one second. Just move this over a little bit so I can look a little bit more at you. Has had healthcare experience, including program and personnel management, opening of new health centers and services and community buildings and networking. She has worked for Planned Parenthood in a variety of locations, including Oakland, California, as well as with UC San Francisco Benioff Children's Hospital in Oakland. Donna is originally from back east in New Jersey and grew up next to the beach. Donna has been living in the Bay Area, San Francisco Bay Area, since coming to California. You can tell us how long ago that was, Donna, and specifically Oakland most recently. She is passionate about providing healthcare in her own community, and she is fabulous. That's not in your bio, but I need to say.
And I currently work for Alameda Health System, which is part of the hospital network. It's not a county hospital, but it functions in that capacity in the ambulatory services. So that's outpatient care.
Okay. And can you tell us, Donna, what's your title? What's your position there?
My title is practice manager. So I oversee infusion services, outpatient infusion services. So people who need to get some treatment and care through infusion. So it's not a pill or it's not necessarily a shot. They have to come in, but it's not in the hospital. It's outside of the hospital. So they go home at the end of the day. And also 8 different specialty services, including our oncology services.
Wow. Okay. That's a lot. Scope of work is quite large. How many folks do you supervise, Donna?
About 40.
Okay. And what are their positions and titles, more or less?
Well, I have a dyad partner, which is really key, who's a nurse. And so we work together to oversee nurses, medical assistants, front desk staff. So they call them patient service representatives. And a few different levels of nurses, so LVNs and certified nursing assistants as well as RNs.
Okay, great. So, and the reason I'm asking is not only because I have a great deal of respect for healthcare. That is where my background is. That's where I continue to go to. Listeners, those of you that are in healthcare, I hope you pay special attention. Donna is my first guest. We've had about a dozen guests so far on the podcast. And my first guest that isn't an author, isn't running a business, hasn't, right? Her message and the conversation that we're going to be having is about a frontline, I mean, not to minimize in any way your position, a frontline supervisor doing the work on the ground, doing the work that we're talking about all the time about how to manage people, how to manage oneself, how to think about work, how to systematize all of that stuff. So let's kick this off, Donna, can you just tell me again, why are we talking? Just tell people what happened.
Well, I guess, and also to kind of elaborate a little bit more what you're saying, I'm not talking about the theoretical, I'm talking about the practical.
Yes.
Yeah.
Yes.
So
yes. Holding
one
up the
one time Danny and I were talking because we talk outside of this professional capacity, and I said, I have an idea of something that you should share in your boot camp, because I've had the pleasure, as Danny had mentioned, to do the Management Mastery series, which was Danny's first foray. I don't know if it was your first, actually, but it was my introduction to practical, you know, achievable, thorough, how to, the biggest thing that you need to manage are the people.
mm,
The program
mhm,
is important
and
for
mhm,
sure.
mhm.
But there's a lot of tools to manage a program, and managing the people is the variable that there's a lot less control over. Anyway,
Oh my,
so Danny and I were talking, and I said, here's the thing. Working in healthcare, although I've had other positions, but as a manager, it's been exclusively in healthcare. Um, there's a focus, especially now that I work in a place that's connected to a hospital, to manage an emergency. And you have to do that in healthcare sometimes. Things will come through, and hospitals could be code blue and, whatever. But we don't want to be doing emergency management all the time. We don't want to
nice.
be reacting to things, putting out fires. We want to do, which is kind of interesting because on some level I'm all about the fun. You need to have fun at work too, and in the little things, but you
Mhm.
want it to be a little bit boring. You don't want to be reacting to things all the time. You want to have
I love
strategic
you.
strategic plans so that you can have the fun times be the potluck, well, when we're after COVID, I guess, or the fun times be Spirit Week. We just had Spirit Week at work, where the staff said, yeah, let's, because it's been tiring. We've been wearing masks for 3 years.
Mhm.
So that's where you want to funnel your fun energy, and not on the excitement into always managing an emergency.
Yes.
But I feel like healthcare professionals function, especially the ones that I've had the privilege of working with, they're great at that. A medical emergency happens, and they are right there. They know just what to do. They help it from, becoming even worse. They get right on top of it, but there's an adrenaline rush that's associated with that.
Mhm.
And
Mhm.
that is not a helpful way to
Mhm.
manage the other pieces of the puzzle. You need to have that energy for, true emergencies that you couldn't have prevented from happening.
I love this. I love this so much. What you said is making my heart sing. Um, I really appreciate what you just said about this isn't just about getting the work done. There's a lot of energy management that needs to happen, both for yourself and for your team, because you need it for certain things. And I love what you said about, you basically said when you're successful, you're a bit bored. That there's right and to a degree that we want some stability so that we can have that energy management. And so we can actually, you really got me thinking about, and I'm wondering how you would think about this. So if you remember from Management Mastery series, and we talk about this in the Best Boss Bootcamp, Covey's quadrants of time management with urgent versus
Mhm.
important. Remember
Mhm.
that?
Yes, I
So
do.
right? So those things that are urgent and important, and there's a lot of those things we need to manage. And the things that are urgent and not important, we need to get out, right? Because they're
That's
not
right.
working. The things that are not urgent and not important, we shouldn't be doing in the first place. And Covey says, and I'm hearing you say, you want to spend as much time in quadrant two, which is dealing with situations and thinking about work that is important but not urgent.
This is and we have more power than we think to
Mm,
prevent some of those things from becoming urgent. For example, drama.
ah,
I'm into a no drama zone, because you let the drama sneak in, and then it just gets its own energy, it snowballs, and then you seriously have to manage that because it will grow and it will become toxic. And
Amen.
it's hard to do that because you have
Yeah.
all these different personalities and you have different perspectives. And when I huddled with my staff yesterday, I said, here's what happens. If you notice something that's a little bit off, then you can do one of three things. You can say, you know what? Maybe it was just a weird Monday and that was a little bit off. I'm not going to really deal with it. I'm going to completely let it go. And I trust this person. I know it was nothing. I'm just moving on to the next thing. If you can't let go of it, or if maybe it was the second time it happened, it's perfectly fine to politely and professionally take that person inside and say, hey, just wanted to check this out with you. Did I read this right? Because whatever, and deal with it directly. If sometimes that can be hard for people. And so you can also hopefully go to your manager or supervisor and say, give me some advice about how I can address this, or, what would you suggest? Or did you observe this too? And you could also have like a little mediation if you want, if you feel like, I kind of want you to be there with me when I talk to this person. All of those are great options. But what you can't do is talk about it with your coworkers. Because as soon
Yeah.
as you talk about it with your coworkers, then it creates this energy and it becomes an us and them, and we just don't have time for that.
Yeah.
So
Yes.
that,
Yes.
that's what we have spoken about. And then it empowers the staff
Mm,
who don't want to get sucked into that to
mm,
say,
mm.
let's talk about that with Donna, or let's,
Yeah.
whatever, rather than feeling like, well, staff have told me before, well, I didn't want to be impolite and not listen to the person. And I was like, you don't have to be impolite, but you can also set your, limits too. It's like, you know what? I don't feel so comfortable chatting about this. Let's do something more productive to make it be a better, situation. So you have to say that not just once. You have to
Mm.
repeat it, now and again. And especially if something is drama's rearing its ugly little head, then you have to remind people again. And certainly when new
Mm.
people come into the team, you have to say it. But I've found that for the most part, especially if you are aware of saying that when you're hiring people, that they'll be part of that from the beginning, that they're there. Healthcare is such an honorable profession. They're, for the most part, people are there for the mission,
Mm.
and
Mm.
they're there to help the patient. And they can turn on reality shows if they want drama and not have it be a work.
Yeah, nicely put. Very nicely put. And I so appreciate and applaud you for, you know, so just adopting, and using the tools that have you've learned, right? Because I recognize those tools, and the way you're
Yes.
thinking about this is from a system perspective, and where in the system to have the highest leverage. I mean, that's where my head goes. And so part of that is that leveraging the system is to make sure that the right people are coming into the system, that they're aware of the system when they come in, that you're clear about the parameters of the system, right? And how people are connecting with each other. You're reminding people, I don't know if you remember the rule of six, but you need to say an important message 6 times in six different ways for it to really stick. I just hear a lot of insight and wisdom. I hear tools, but I also hear wisdom. So yeah, Donna, can you say a little bit about, so you went through the Management Mastery series a number of years ago. You've kept a lot of the tools and insights, and you said something before the podcast to me about what a shame it is for that managers often don't have the training that they need. Can you talk a little bit about that?
Sure. I mean, I think that, a lot of management, I feel like, is logic, and being true to yourself. But I think there's a lot of pressure to not make mistakes. And unfortunately, I think it's wrong to think that way. I think it's important to make mistakes because we learn from them. I mean, there's some mistakes you certainly shouldn't make the same mistake over and over again. And there's some mistakes that aren't okay to make. But, if you're not making a mistake now and again, you're not trying anything new, or you're not, involving other people, and you're not letting the other people know, sometimes a mistake, oh, I chose the wrong billing code. Okay, that's a fixable mistake. That's very different than, oh, I chose the wrong medication. Like those are really
Right.
separate things. But you want your staff to know, well, I made a mistake. And if it's one of those ones that's, there's no severe consequences or whatever, or even if there can be something going on, come to me. I got your back. I want to help you manage through this mistake. And then what we want to do is look, are there systems that we need to create to prevent this mistake from happening in the future? Or was it just a one off? Sometimes things just happen, a piece of paper fell off, or something like that. But sometimes, if we aren't learning from the mistake and trying to say, is this a systems issue that we can, prevent it in the future? That's, priceless, because then you
Mhm.
get back to being bored again and you
Yeah,
can just have fun at the potlucks.
that's right. Yes, that's right. That's right. Exactly. Yeah, I love that.
But
Uh,
there really isn't too much training for managers for that, to come
mhm.
back to that. And so, having that time to affirm, trying new things and thinking about not just reacting to that situation, but preventing future, occurrences of it, it just is not, um, I don't know. I feel like it's not a natural way for everyone to
Right.
think.
Right.
And once you bring it to someone's attention, then I feel like, oh yeah, that would be good. We had an incident at work where um, um, very thorough. Um, uh, the team that does the cleaning in our compounding pharmacy for infusion services. They were cleaning, and there happened to be near the sprinkler a little glass cover that prevents, that is like the sprinkler system. It's a little glass cover, and when it gets hot, if there's a fire, God forbid, then that melts, and then the sprinkler system goes off.
Right.
Well,
Right.
they were cleaning, there was a dust bunny there or something, and
Right.
the glass thing fell off, and the
Oh,
water sprinkler went off in the compounding pharmacy while the pharmacist was in there. But the water
wow.
that was in there had been there for a while, and
Okay.
so it came out as black sludge.
Oh my
And
God.
and
Right.
but we didn't know what it was, and it had a foul odor, and we have patients in infusion services. The compounding pharmacy is right there, and we're seeing this black sludge come out, and the code red is going off, and we have patients getting, chemo treatment, and then we're hearing we have to evacuate because there's code red, which means a fire. And so anyway, long story longer. So
Oh,
afterwards, I said, I want to have a debrief about what happened. And I find
mm,
out this has happened 2 or 3 other times in different parts of the hospital. But no one took the, well, that's not, I don't want it to be bad. People didn't take the initiative or next step to say, hey,
mhm,
great
mhm.
cleaning EVS team, environmental services team, don't touch the sprinklers because that little glass thing might come off, and that's what will cause the issue. So it was really from the beginning a training issue to prevent it from happening so we can be bored again.
Yes, exactly. Exactly. Wow, what a great story. I had forgotten about that story. You told me it before, but just such a great story around leadership, around initiative, and again around systems and recognizing, and you said it so beautifully. This isn't, and you said it another time too about when you were talking about how you, what the messages that you give your direct reports about. This doesn't have to be, this isn't about you. We're going to look at the system, how the system is getting in your way, and not solve you. It's not about a personal defect in the cleaning people or anybody. There's a system issue, and somebody needs to kind of keep that view and to go into it and say, what's the real reason here? What's the real reason here? And you did that. It's because nobody got the warning to say, just stay away from the little glass things.
Right.
Brilliant.
And
Brilliant.
it didn't, the debrief session was
Yeah.
not um, as I had envisioned it, because there was some feeling of being defensive initially until I had to keep repeating, look, this is not about you. This is just about figuring out what we could do. But people, rightfully so, because that's how the world is a little bit. It's like 0 or 100. Either you did
Yes.
it wrong or you did it right. And it wasn't like that. And so I think that people felt at the end, I said quite a few times, the person who caused code sludge, he was wonderful. He just works so hard. He's cleaning so hard. He's communicative. He's, all that. Please, let's not have it be about that. Let's have it be about how we can, really look at the system and prevent it from happening again.
So good. So good. Donna, I want to thank you. We're going to wrap up. This certainly begs part two, perhaps with a different focus, but just your wisdom, your insight, your everything. In fact, there's one question I need to ask you. So I happen to know that you're going through, some challenges at work. And so how do you replenish yourself? How do you fill your own well? How do you stay, how do you not how do you keep yourself sane when stuff is going crazy?
I don't know. I don't know if I have that answer. I feel like sometimes maybe I don't focus on myself enough outside of work to make sure I do the things to take care of myself. I think I could grow in that area. But I do have to say, I find incredible enjoyment and happiness out of the little things. And so when I have, a patient just this past week say, oh, thank you so much for listening. Or I have a staff person who says, oh my gosh, that was so funny. Or, thanks for doing that. Or, I go to talk to someone and I say, I wanted to let you know at the huddle, what you mentioned was really powerful. And please feel free to share that, next time. And they think initially they're nervous about saying something, and I see them beam, or, that just means so much to me, being able to bring people along the journey with you, I think is professionally, is kind of just carries me along.
That's awesome. That's awesome. And listener, no matter where you are on the spectrum, you can do that to find the joy in the little things. And actually, there is some really good science that supports that's how culture change happens, how attitude happens. It's not big things, it's the little things, and a lot of little things. So find those things. And Donna, I know you don't have an office necessarily, for people to call. Most of my guests have been authors or speakers or consultants. But how can people find you if they just want to kind of hear some more wisdom from you or just connect with you?
Well, if they want to connect with me, I don't know how we would necessarily do it on, by just looking at my profile, but I'm on LinkedIn, and
Okay.
I have a lot of professional connections on LinkedIn. So, who
Nice.
knows? Maybe we'll be writing a book together, Danny. I don't know.
Oh, stop it. Stop it. This is another like big green thumbs up idea. Awesome. Awesome. All right, Donna. Well, I'm going to let you go, but dear listener, thank you so much for joining us today. Donna, thank you, thank you, thank you for your time, your energy, your wisdom, and your leadership.
Thank you, Danny. It's always a pleasure to speak with you. Seriously, you are one of the people, when I look at my trajectory into management, that I'm thankful that I was able to cross paths with you early on, so that I've been able to have your wisdom and your suggestions and move that forward.
Oh my goodness. Thank you so much. That warms the cockles of my heart. Thank you so much. All right, dear listener, thank you for joining us. And viewer, I hope we'll get some viewers on YouTube pretty soon. This is Danny Ceballos with Unleashed Consulting and the Best Boss Bootcamp podcast. Thank you so much for joining us. We'll see you next time. Bye now.